Amid a raging spike in coronavirus cases that touched an all-time high of nearly 274,000 new cases on Sunday, India has announced a fresh lockdown in many parts of this vast South Asian country, including capital New Delhi, as authorities scramble to get the situation under control. The government on Monday also announced that all adults above the age of 18 will be eligible for COVID-19 vaccines from May 1st. The medical infrastructure, nevertheless, is overwhelmed by the surging cases, with reports of shortage in hospital beds, oxygen, key medication, and even vaccination. Doctors and healthcare workers are facing an uphill task to deal with the unprecedented crisis. Meanwhile, the Indian government's handling of the second wave has also come under scanner, considering it permitted massive election rallies and religious festivals, even as the COVID-19 cases skyrocket. To understand the plight of the medical fraternity in fighting this immense challenge and how is India coping up with the situation, we have with us Dr. Subharga Kumar, the founder of 5 Elements Medical Center in Gurgaon, in the outskirts of the national capital. Welcome to CGTN Digital, Dr. Kumar.
Yeah, thank you. My pleasure.
What are your first thoughts on the latest measures that makes anyone above 18 plus years eligible for vaccination? Considering there are already reports of vaccine shortages in India, what are the plans in place to meet the additional demands that will come from May 1st onwards?
I think the government has taken a good decision in that, because we had an earlier discussion, I discussed with you as well regarding this point. The vaccination should be for all. It should not be age limited or something like that in the current scenario. So I think this is a good decision, and we as a doctor should welcome this, because I was continuously thinking, why not? Why not government is allowing 18 plus to go ahead and vaccinate? People are eagerly waiting for the vaccine. Some are eagerly, the youths are eagerly waiting, yes, when will my number will come? Why the age bar is only 45, when so much the mortality has increased and the virus has changed. So I think the demand, the production has gone up, and the government is planning to increase the production approximately 6 to 7 times fold more. And whatever data I have read in the news or in the literature, I think by July or August, government is planning to increase the vaccine around 100 million doses per month. So if that happens, then I don't think there will be any more shortage of vaccine in this country in the current scenario. And plus, the government has allowed the Sputnik vaccine also to be given in the Indian people. So I think it's a good decision.
Right. And as we speak, in the past few days, we have seen in India, it's facing its worst COVID-19 spike. There are reports, as we talked about, shortage in vaccine, but also of hospital beds, oxygen, key medication, etc., from across the country. As a doctor, if you can give us some idea as to how worse is the ground situation, and how are you as a doctor and your colleagues in the medical fraternity coping with it?
See, obviously, as a doctor, we cannot deny our duty. We are just like soldiers put up on the LOC border. It's a war. It's a war. So we cannot deny our duty. We are working continuously, whether it's a doctor working in a government sector or a corporate sector, or doctors like us who are running their own private clinics and medical centers. We are continuously seeing patients of COVID. Very well, as a doctor, we are continuously running. We don't have any day or night duties. There is nothing as such. That the PG students, the postgraduate students who are pursuing courses in different medical colleges and hospitals, their duties, the period of time frame of their graduation degrees have been extended for further 3 months. They have to pursue further 3 months course to serve as a COVID doctor, so that there is no more shortage of doctors in the country. We are not gods, we are human beings. We cannot cater all the patients flocking in the hospitals night and day, just coming in, and we cannot. There has some limitation, there has some capacity within us also. So this, I am not in a favor of lockdown, but if any by chance this situation goes out of control, I think that there should be a lockdown countrywide, or at least the hotspots in the country where they are like Maharashtra, like New Delhi and all, so that at least the hospital sectors and the doctors get some time to cope up with the situation.
Okay, and if we can now talk about the new strain that has come from emerged in India this time around, The WHO is warning that the double mutant COVID-19 variant from India is more contagious and could have a global impact on even countermeasures such as vaccine exports, considering India is the world's largest vaccine manufacturer. What is your assessment of this new variant and how dangerous it is?
See, the new variant, or some people are started calling as a India new double mutant, is a B.1.617 kind of virus with a double mutation, with a two mutation in it. So virus tends to mutate all the time because it is has a tendency. Its evolutionary biology is such that it has to mutate. So sometimes the mutation makes it stronger, and sometimes the mutation makes it weaker as well. So double mutation, it's not that it's only found in India only. It's found across the 10 countries as well, including US, UK, Germany, Singapore, New Zealand, Ireland, etc. So right now we don't have sufficient data to claim it as this is going to hamper the vaccination, or the people who have been vaccinated, it's not going to affect in that.
In recent weeks, people have been left flummoxed by the images of massive election rallies and millions taking a dip in the Ganges River for a religious festival, the Kumbh festival, which is one of the big Hindu festival and comes after every 6 or 12 months, 12 years. This happened despite the alarming pandemic situation in India. What are your thoughts on this? And do you think that the authorities could have handled the situation differently and in a better manner?
See, about the Kumbh Mela, because you as well being an Indian, you know India is a country of faith and religion. We blindly have faith upon our Hindu gods and deities and these all things. So you cannot stop a Kumbh Mela when there is no lockdown enforced in the country. It has to happen, just like the Holi happened recently last month. So I personally, as a doctor, I think it had to be a more planned way. There have to be more testing centers should have been placed there. There should have been a doctor, at least a paramedics placed more. There are paramedics and testing centers in the Kumbh region, in Prayagraj and wherever it is happening. But the number has to be increased. Seeing the current scenario, now the government has started increasing the testing centers, and they have started tracking the patients or the persons who are returning back from the Kumbh Mela. They have been set to be 14 days quarantine, compulsory quarantine of 14 days at home. They have to do. So this is a nice move. We cannot stop the Kumbh Mela, but we can at least filter the persons coming from this Kumbh Melas and all, so that they cannot spread the and upon this election, see, India is a democratic country, the largest democracy in the world. So in such a country, election has to happen. But as a personal citizen of India and a doctor, I personally think this could have been postponed further 6 months.
So considering the situation now, and as a medical professional, what are the urgent changes that you would like to see at the ground level for smooth implementation of all these measures that the government has announced? Also at the policy level for a long-term, enhancement of the national healthcare system, perhaps, so that it doesn't get overwhelmed in the long term.
What people can do, let me answer that question. As a citizen, as a layman, as a person who is not a doctor, the only thing is that they can take precautionary measures, because prevention is better than cure. We all know that. So if you are not a healthcare worker, if you are not an official worker who has to go to the office, who has to attend a medical hospital or a clinic, better don't come out of your home, stay indoor. If you at all you need to go out for some official work, use a good quality of mask. Just right now we are advising at least use two layer of mask, so that it's better protective, gives you a better protectivity. Strict hand hygiene should be followed. Social distancing. If you are seeing any person who is not wearing a mask, who is not following protocols of social distancing, educate him or her. So we have to cope up with the vaccine manufacturing. We have to double up, triple up, or 10 times more, so that all the citizens, because India is a very, very large country. After China, is the second most populous country in the world. So it's not an easy task to vaccinate 130 crore people. So for a herd immunity, at least 60% of the population has to get vaccinated. If like Sputnik, if government plans to allow more vaccines to get in, they allow more vaccines to come in the country so that we can scale up the vaccination drive. There should be a door-to-door campaigning of the vaccine, just like the pulse polio drive. If the patient and the people are not coming to us, better we go with to them, choose a society, pick a society. We will target this society, and yeah, our target is to vaccinate this 100 of people in 24 hours, just like the pulse polio drive. There should be mobile testing clinics, mobile vaccine vans in rural areas, in villages where people are still afraid of getting vaccinated.
Right. So as you rightly mentioned, India and China are the two most populous countries. And in a pandemic situation, of course, numbers are also very crucial because it impacts policy making, it impacts strategy, it impacts how to implement those policies at the ground level because of the numbers. So considering the similar population size, do you think as our Indian healthcare sector and medical professionals looking at some of China's COVID-19 containment strategy as well, which had been successful to a large extent, to maybe adopt some of these relevant practices? And do you think that medical fraternity from the two countries, not only the two countries actually, and perhaps even other countries, it's a global pandemic at the end of the day, must have more exchanges to cooperate and collaborate against this huge global threat?
Of course, of course. Initially I told you, Abhishek, it's not a question of caste, creed, or religion, or borders of, or something like that. It's the very question of existence of human race on this planet. It's question of our Earth planet. It's not question of China or America or India or something like that. If something is coming, something positive is coming from any part of the country, if any part of the world, whether it is China or whether it is Pakistan itself, if it has got some positive effect on the pandemic, we should, as a doctor, as a human being, as a student of medical science, I welcome this. We should we should incorporate with them and try to fight this global pandemic. It's a war. It's not a war against any territorial border. It's a war against human race. So if something is coming, if China has some good plans in containment, if China has come with a new drug, if China's vaccine has got more potential, why not? Why not?
Right. So, and at a time when the pandemic has been politicized globally, do you think that there is a need to bring the conversations actually back to science with a focus on international cooperation?
We have right now, we have only one enemy. That's COVID-19. It's our main enemy. We should join hands if possible. Ultimately, it's the decision of both of the governments. But as a doctor, I think if there is something positive coming from India or from China, we should collaborate and we should fight and how to cope up with this global pandemic. And we should create an example.
Okay, on that note, thank you very much, Dr. Subhar Kumar, for joining with us and giving us a lowdown on the situation in India and how it has to be tackled in days to come. Thank you very much.
Thank you. My pleasure.